Dr. Archana is also associated with the media literacy campaign Factshala and BBC Young Reporter India to generate awareness towards fake news. She has also worked as a freelancer for many print and online media and is the author of the poetry book Khidki Bardoop.
Dr. Dilip Kumar. Dr. Dilip Kumar is working as an associate professor and course coordinator in English journalism at the Indian Institute of Mass Communication, Northern Regional Campus in Jammu. He is a journalist turned media academician with 18 plus years of rich experience. He was the HOD and professor of journalism and mass communication at the Management Education and Research Institute. He has done postdoctoral studies sponsored by ICSSR. He is a doctorate in journalism and mass communication and political science with a rich experience in the field of media laws and ethics, media research, and issues of international relations. Professor Dilip Kumar has also participated in 150 national and international conferences as a keynote speaker, a resource person, moderator, as well as organized more than 200 plus seminars, conferences, webinars as a convener. He has authored 94 publications and written 1,000 plus articles in national newspapers and magazines.
Dr. Ruhi Lal is Head Student Support and Associate Professor with Amity School Communication, Amity University, Noida. Dr. Lal is a highly skilled advertising professional, academician, and researcher, having 22 years of work experience. She's DLIT from Vinoba Bhave University, Hazaribagh, Jharkhand State University, and holds a PhD degree in mass communication. Is the recipient of Best Media Educator of the Year 2021 in Advertising Research by the Media Federation of India, the fifth Gyan Shri National Award for Promoting Talents in Hindi Literature from Savitri Foundations, and Vishisht Seva Samman from BJP Delhi for delivering services to specially able people in December 2021. She has a work experience blend of 8 years with HT Media Limited, Purple Focus Private Limited, and Noida Ad Agency, and 15 years of teaching and research experience at Amity School of Communication. Dr. Lal has 104 research contributions, 8 books, 32 research papers, national international journals with high impact factors, 30 case studies, 29 paper presentations, and 10 chapters in books. The 6 funded projects done by her include MGNCRE MHRD, Swayam MHRD, AJK MCRC MHRD, Radio Amity and Amity MOOC project. Dr. Lal chaired many technical sessions at national international conferences and has conducted workshops on advertising research methods, qualitative research methods, campaign planning, and storytelling in advertising. She served as IQAC head, stream head for advertising and marketing communication, board of studies, AAB and PRC committee member, academic advisory board, outcome assessment head, academic planning and review committee member, external examiner, paper setter, and guest speaker for many universities. She has also chaired more than 50 admission boards for the selection of students. Dr. Lal chaired many technical sessions at national international conferences and has conducted workshops on advertising research methods, qualitative research methods, campaign planning, and storytelling in advertising. Thank you so
Dr.
much.
V. Ratnamala. Dr. V. Ratnamala is a professor in the Department of Mass Communication, Mizoram, India. She was a visiting fellow at Institute for Comparative Modernities, Cornell University, New York, from February to May 2020. She's also the coordinator for the Technology Enabling Center at Mizoram University, sponsored by the Department of Science and Technology. She completed her PhD from Manonmaniam Sundaranar University, Tirunelveli, Tamil Nadu. Prior to joining Mizoram University, she worked as a lecturer in the Department of Mass Communication, Manonmaniyam Sundaranar University, for 3 years. Dr. Ratnamala has presented papers at national and international conferences. She has also successfully guided and awarded 4 PhD scholars and more than 50 postgraduate dissertations. Dr. Ratnamala was a recipient of Young Scholar Award from CPR South in 2014. She recently completed a joint research project titled Race, Space and the City under ICSSR NIHSS Joint Research Program in Social Sciences. She collaborated with Professor Rosina Mart, the Director, Center for Critical Research on Race and Identity, University of KwaZulu-Natal, Durban, South Africa, for the project.
I now humbly request our speaker and moderator, Dr. V. Ratnamala, to take over the session. On to you, ma'am.
Okay, thank you. So, good afternoon, everyone. And it's my great pleasure and privilege to be part of this wonderful session on demystifying communication strategies towards sustainable development goals. So, my heartfelt thanks to Dr. Dinesh and his team for organizing this important conference symposium, that is ISMER 2023. So I know it's a post-lunch session and it's a challenge for the listeners and also the speakers. So let us make it try to be like as brief as possible. And then, so let me introduce this topic, sustainable development goals. And you all know that the 2030 agenda for sustainable development adopts by UN member states in 2015 agreed to work on 17 sustainable development goals. So although we have like 17 sustainable development goals, today we are going to only focus on two, three sustainable development goals. And you all know that COVID-19 and its aftermath threatened the sustainable development goals and the very survival of humanity. So, more than 4 years of progress in alleviating poverty has been erased by COVID 19. It is also threatening the decades of progress in global health, conflict, COVID 19, climate change, and growing inequalities, and they are also undermining the global food security. So, COVID 19 has also deepened the global learning crisis. So, the meanwhile, the world is on the verge of climate catastrophe when millions of people already feeling the consequences. So discussing about this sustainable development goals is the need of the hour. And then today we have four speakers in this session, including me. And then, Dr. Dilip Kumar, he'll be talking on the first sustainable development goal, that is on poverty reduction. And then Ruhi Lal, Dr. Ruhi, she'll be like speaking on the fourth sustainable development goal on quality education, and Archana ma'am will be giving about like how to burst the myths of in the sustainable development goals, and I'll be like speaking on the third sustainable development goal, that is the good health and well-being. So now let me invite Dr. Ruhi Lal to give her presentation on mass media discussions on quality education. Yeah.
A very good afternoon to one and all present here. Am I audible?
Yes, ma'am, you are audible. Yeah.
So I'm honored to be part of this international symposium. And the theme given to me, as discussed, is Goal 4, that is quality education. And today we are here to talk about demystifying communication strategies toward achieving the Sustainable Development Goal. So, demystifying communication strategies, that means involving simplifying communication and making it more accessible to different audiences. It requires a clear understanding of SDG, the target audiences, and the communication channels that are most effective in reaching them. We all know that there are set of 17 goals established by United Nations to be achieved by 2030. These goals cover a wide range of areas such as poverty reduction, quality education, clean water and sanitation, gender equality, affordable and clean energy, climate action, and more. In order to achieve these goals, it is essential that we have effective communication strategies that can demystify the SDGs and create awareness about the actions needed to achieve them. So it is very important to use simple and clear language when communicating about SDGs. The language used should be easy to understand to avoid technical jargons that may be confusing for the audiences. This will ensure the message is easily understood and can be acted upon. We need to use various communication channels to reach the different audience, which include social media, radio, TV, print media, and other platforms. By using variety of channel, we can reach to wider audiences and ensure the message is heard by everyone. And the storytelling, which is also a very powerful tool to communicate about SDGs to engage audiences. Stories have the power to inspire and motivate people to take action. They can be used to illustrate the impact of SDGs, especially quality education, on people's life, highlight success stories, and inspire collective action. Involving communities in communication process is essential, and we need to engage the local communities, listen to their concerns, involve them in decision making process, which will help to ensure the communication strategies are tailored to their need and to be more effective. And it is important to measure the impact of these communication strategies. By monitoring the success of communication efforts, we can identify what is working well and what need to be improved, and partnership with the organizations like private sector, government, and other organization, which can mobilize resources and leverage expertise to communicate effectively about the SDG. So partnership can also help to ensure the communication efforts which are coordinated and aligned with overall goals of SDG. So here I have given a goal 4. My session is dedicated to goal 4, that is the quality education, which is the fundamental human right and a key driver of sustainable development. Providing quality education to all is essential for building peaceful and prosperous societies. Quality education is the fourth goal of 17 Sustainable Development Goal adopted by United Nations in 2050, which aim to ensure that all girls and boys have access to free, equitable, and quality primary and secondary education by 2030. Here comes the role of mass media discussion in promoting quality education. They can help to raise awareness about the importance of education, highlight the challenges faced by education sector, and promote policies and practices that support quality education. It is very important that quality education should be considered very seriously, because it is the foundation for personal and social development and is essential for achieving all other SDGs. Education is the key to ending poverty, promoting gender equality, improving health outcomes, reducing inequality, and fostering economic growth. One important aspect of quality education is ensuring that all children have access to education. Mass media discussion can help to raise awareness about importance of access to education, especially for marginalized and disadvantaged groups. They can highlight the challenges that prevent children from attending school, such as poverty, conflict, discrimination. So, mass media discussion can promote policies and programs that support access to education. as a school feeding program, scholarships for students, transportation facilities to the students. So all these will help to achieve the sustainable development goal 4. Another important aspect of quality education is the quality of teaching and learning. Mass media discussion can help to promote effective teaching practices such as learner centered approach, interactive teaching methods, and use of technology in the classroom. They can also highlight the importance of teacher training and professional development, as well as need for adequate resources and infrastructure in schools and colleges. It can help to promote education for sustainable development. They can raise awareness about importance of environmental education, global citizenship education, human rights education. They can also highlight the role of education promoting social justice, peace, and equality. So, through Goal 5, we can achieve other sustainable goals as well. So, mass media discussion on quality education, which play a very critical role in promoting access to education, quality teaching, learning, education, and which highlight the challenges facing the education sector. We can work together to ensure that all children have access to quality education, and quality education by providing skills and knowledge they need to become productive member of the society. It teaches critical thinking, problem solving, communication, collaboration skills that are essential for the success of 21st century. So it also helps children to develop sense of identity, self-esteem, and respect for other, which all is possible with the help of achieving sustainable development goal 4. It's not just access to education but also quality of education. It is being ensuring that a student to receive support, resources, opportunity they need to learn and develop to their full potential. This includes quality teaching, relevant and up to date curricula, safe and inclusive learning environment, access to technology, and other resources. Achieving quality education requires collective effort of government, civil society organization, educators, parents, and students themselves. So it requires investment in educational infrastructure, teacher training, development of relevant and up-to-date curricula. It requires focus on equity, equity and inclusion, quality education. It should be accessible to all, and addressing the barrier that prevent children from accessing education, such as poverty, conflict, discrimination, disability. So we have to focus on all these so that we can achieve goal 4.
Can you sum up in
So in
100 seconds?
conclusion, I would like to say quality education is a crucial SDG goal that is essential for achieving sustainable development. It provides students with the skill and knowledge they need to become productive member of the society, and essential for ending poverty, promoting gender equality, improving health outcome, reducing inequality. So we all have to work together to achieve sustainable development goal 4, that is quality education for everyone. So thank you so much for giving me opportunity to be the part of this conference, and to talk on this with the eminent experts which are present here in this international symposium. Thank you so much.
Thank you so much, ma'am. So it was an interesting talk. So let us have the question answer session at the end. So thank you so much for sticking to the time. So now I may call Dr. Dilip Kumar to present on government initiatives via media for poverty reduction.
Thank you, ma'am, for giving me such a wonderful opportunity to speak on such a meaningful topic which I have given, government initiative via media for poverty reduction. So first of all, I thanks to organizers, ISMER, if I'm right. And before that, I want to do some my regards or pay my regards to Ma Amrita Mai, Charan Bandana. And then after that, yes, namaste to all dignitaries. And after that, yes, I'll speak on a topic government initiative via media for poverty reduction. Poverty elevation refers to the set of measures and government interventions, both economic and humanitarian, to lift people out of the vicious or circle of poverty. Yes, it is the uh, initiative of the government of any country to ensure the well-being of its citizens by providing them opportunity to emerge out the poverty. This can be done by fostering economic growth, which in turn will generate employment, thereby reducing poverty, or like that. Hence, a country needs to have a comprehensive poverty reduction strategy in India. Government since independence, not even from last 10, 20 or 30 years, from since independence, have been trying to implement schemes and strategy for employment generation and poverty reduction. Definitely, we will talk with this particular thing, uh, starting with the poverty definition. As we know, we all having knowledge about the poverty, but still, poverty is a condition wherein an individual lacks the financial resources and essential conditions for meeting the minimum standards of living. It refers to the conditions wherein the economic conditions of a person is so low that even the most basic needs are not met. Uh, there are two types of, even if we can categorize the poverty, there are two types of poverty we can see. First one is absolute poverty, and second one is relative poverty. Let us discuss or just take a glance for each one. Absolute poverty refers to the condition wherein an individual is bereft of even the basic necessities, including food, shelter, and clothing, to meet the basic living standards. Introduced in 1990, it identified those living below $1 a day as a being in just a minute. So yes, introduced in 1990, it identified those living below $1 approx. If we can take today's example, around rupees 82.26, uh, as being in absolute poverty. We can say that is not a good scenario for our country, but still we are trying our level best to reduce all those things, and media even very much essential or powerful tools for reducing all those things with the help of government initiatives, and to initiate all those informations and spread among the masses for reducing or creating awareness regarding all those. In 2015, the World Bank reconsidered it and reset the poverty line to dollar 1.90 a day, around you can say rupees 150 or something like that. Similarly, we can take the relative poverty as well. Relative poverty is a condition where the other countries having a major role to compare with uh, all the minimum necessity for improving yourself, or being a country you can improve for particular that direction. So if just in a nutshell, we can say these two type of poverty having an our country like India, and the government initiatives are very much important regarding all those, and media will play a vital role to help the people to take such awareness what the government is doing right now. So if we can take one by one, So, considering the importance of poverty alleviation to foster economic growth in a country, in the government of India has since independence, as we already know, taken various measures in the form of initiative and schemes to alleviate poverty and to generate employment. Some of these initiatives are we can discuss even. First one is Integrated Rural Development Program (IRDP), Jawahar Rozgar Yojana, Jawahar Gram Samriddhi Yojana, Rural Housing Indra Awas Yojana, Food for Work Program, National Old Age Pension Scheme (NOAPS), Annapurna schemes, Sampurna Gramin Rozgar Yojana, uh, Mahatma Gandhi National Rural Employment Guarantee Act (Manrega 2005), National Rural Livelihood Mission Ajivika 2011, National Urban Livelihood Mission, Pradhan Mantri Kaushal Vikas Yojana, as you know, Pradhan Mantri Jan Dhan Yojana. We all know about all those. A lot of other yojanas and schemes already in a line, but due to some time crisis, I'll try to sum up my talk within a time limit. As we all know, there is some time restrictions. As chair earlier restrict ourselves, you have to speak within the time frame. So, government initiative for employment generation in India, we can take it as a very nutshell. First one, if we want to talk about Nehru Rozgar Yojana, National Food for Work Program, training of rural youth for self-employment, National Rural Employment Program, Rural Landscape Employment Guarantee Program, Johar Rozgar Yojana, Rural Employment Generation Program, Prime Minister Rozgar Yojana for educated unemployed youth, स्वर्ण जयंती शहरी रोजगार योजना, स्वर्ण जयंती ग्राम स्वराज योजना. These are the major initiative taken by the government. Even apart from that, we can take Sampurna Gramin Rozgar Yojana, National Rural Employment Guarantee Schemes, Employment Assurance Schemes, Deen Dayal Upadhyaya Gramin Kaushal Yojana. It's a very much important and very focused by the recent government schemes by which we can try to remove the different aspects of poverty from each and every corner of this country. So it's a very much important one. Even Pradhan Mantri Kaushal Vikas Yojana, as you know, PMKY, KVY is a very much futuristic scheme of the government, and with this kind of schemes, definitely we are very much close to achieve the SDG first goal. Within if the entire things will be with the same speed what the governments right now doing in this particular time, we will be achieved before the 2030. So we can say yes, these are the schemes. On the basis of that, we can achieve the SDG kind of exercise which was done by the UNO. But just I want to say, it's not a new scheme which one given by the UNO right now with under the SDG. If we can go through the Deen Dayal Upadhyaya ji work regarding the Antyodaya kind of exercise, uh, the we can even we have already 12 to 13
So can
goals.
you sum up in another 1 minute?
Yeah,
Already we exceeded the time.
within 30 seconds I'll sum up. Don't worry. So with this kind of exercise, we did definitely achieve the SDG first goal in a very constructive manner, and we will be the example of the world, and definitely we will be the in other aspects we will be the very soon the paths for country of the other underdeveloping country. Thank you very much.
Yeah. Thank you, Dr. Dilip, for an interesting discussion on poverty reduction. So now I may call upon Dr. Archana Kumari ma'am to give a presentation on busting myths regarding this communication strategies towards SDG.
Thank you very much, Ratnamala ma'am. Thank you very much, the organizations of ISMER. This is a great opportunity when I am talking with my fabulous co-panelists. And the topic which I have chosen for today's talk is myths. I just want to talk about the busting the myths about sustainable development goals. There are so many myths which we actually talk about, and even sustainability itself has become a cliche. There are many people who talk about it without knowing that what is it. But the problem which we do not understand, that there are people who have a sense of it. So myth number one is that nobody knows what sustainability really means, which is a myth, because we understand the sense of it, and it is not a new word which has been coined. It was already there in 1987 when it was introduced, and the meaning of it is sustainability is the development that needs the present needs that fulfills the needs of the present without compromising the ability of future generation to meet their own needs. Or in other words, we can say that, like, in our school teachers, as they say, when they train our children, they say that don't make more than don't take more than you share. So whatever your share is, take that much only, and do not take more, and keep the other things and other resources for the future generation. Simply, sustainability means that. So there is a myth that people do not understand it, but the real sense of sustainability, I feel that every one of us really understands. But the problem is that many times we associate sustainability with environment, sustainability with green movement, which is to some extent true also, because most of the time we see this word, we hear this word from the mouth of environmentalists only. So the second myth is that sustainability is all about the environment. To some extent, environment is a part of sustainability. We cannot deny it, but it's not only environment about which sustainable development goals are. Just like our previous two speakers have said, that quality education, government policies, these are all part of sustainable development goals. We cannot say that only environment related and climate related things are sustainable goals. So economy is also part of it. The biosphere is a part of it. The nature is a part of it. So this is second goal, which the second myth which I just wanted to highlight, that it's not that only environmental movements are related to sustainability. There are many more other things than that. Again, the theme related to it is that sustainable is a synonym for green. So many people think this myth that sustainability means greenery or green movement. Here, I would say that green is a metaphor which is used to suggest that we should prefer natural things over the artificial, and that's why we have natural movements. We have organic movements now. People are more prone towards using organic things. So green is a metaphor which is being used, but it doesn't mean that sustainability is always a synonym for green, because there are and there is a myth also that over dependence on technology will also kill us. Yes, that is to some extent it is true that if we will actually destroy our ecosystem then and depend more upon technology, it will be difficult for us to survive for long. But the problem is that we have a 3 billion population. We have 6 billion population, which is going to be more 3 billion will be added till the middle of the century. So we cannot provide them comfortable life without the use of technology. So technology should be used, and it should not be discarded outrightly, but it should be used in a feasible manner, in an optimum efficient manner. So that is one important myth, which people think that, okay, sustainability means only green and no technology, nothing like that. So that is also misconception which I just wanted to outline. Then myth number 4 is that it is all about recycling. That if we are recycling everything, that means we are moving towards sustainability. So the problem is that recycling is obviously it is enduring a message from the environmental movement, and there is nothing harm in it. We can actually recycle everything. We can use it. That we can make it our way of life. But that doesn't mean that all the time we should use recycled products only for sustainability. So we need to think that what are we recycling? Is the recycling process is also contributing towards sustainable development, or is it again creating problem in the ecosystem? So that also needs to be taken care of. So such a recycling process is also very important, but how are we doing it? Myth number 4 is sustainability is too expensive. Means it is like having an elephant in the room. So people think that, okay, if we will talk about sustainability, it requires a lot of money, it requires a lot of investment if we talk about sustainability. But this is completely a myth, because There is one this is scholar Gabriel who said that there's a grain of truth to it, but only a grain of truth, not a complete truth. It is that you need a lot of money for sustainable development. It is only for the short term that you have to put your effort and you have to put your resources, but in long run it will pay you back, and it will actually not required to put a large amount of money if you have already developed a system where you are sustainability can be given upper hand, and it can be given a front seat. So the problem is that we have to understand that it's not that only money is important for sustainable development. Our willpower, our day-to-day life, our activities, our actually way of life is also very much important. Also, there is a myth number 6 which says that sustainability means lowering our standard of living. So people think that if we have to if we have to contribute towards sustainable development goals, then we have to spend less, we have to live in less, we have to adjust in less. But actually there are some arguments that we need to organize ourselves instead of living in less things. If we properly organize, most of the time what we see that sustainability gets affected if we are not completely organized, we are not actually using the resources optimum in an efficient way. So that's the problem. Our planning is the problem, our implementation is the problem, not that we have to settle down for the less, not that we cannot live a good life. So innovations are there, breakthroughs are there are extraordinary things which are coming up, and it doesn't mean that we have to settle for the less if we want to go for sustainable development goal. Rather, sustainable development goals are for the best of our life, for the achieving and for giving us the best in our lives. Then there is myth number 7 which says that consumer choices and grassroots activities, not government intervention is required for sustainability. Now, this is also very big mistake when we say that only NGOs and grassroots activism and people's movement is required for sustainability. We need government intervention. We need government support in each and everything. Just like the Lipser has said, that there are so many policies which are coming up for people and deserving people and those marginalized section of the society which need some kind of upliftment. So this is also required, and we cannot say that without the support of government we can actually only on the basis of grassroots activism or with the help of NGOs and our own people's movement we can sustain for long. So that's also a myth which we need to break, and we need to go beyond that. Then there is also one myth which says that new technology is always the answer. uh, it's not like that, because new technology, how efficient it is, how much it is contributing towards the sustainability, is it really contributing or taking much from us? These questions has to be answered, these questions has to be addressed to. So instead of blindly following what is the new technology and embracing it without thinking that how much it is impacting the sustainability, this is very important for us to understand that we cannot embrace all the new technology which is coming up in our way. Then there is a myth number 9 that sustainability is ultimately a population problem. Population is a problem, there is no doubt about it. And but the solution which we are suggesting, that only population control is a solution, is not correct. Although, because population is a problem, but the environmental problem is there. World population where only 100 million people, we would be, means obviously if the world population would be less, we would be really very in a comfort, we would have been in a comfort zone. The resources would have been much more judiciously deployed among people. So sustainability, in first sustainability, population control is important, but it's not only a problem, it's not only a only possible solution. We need to think about many more things. So we first of all we understand the concept, and we first of all we if we understand the myths around it and we try to get away with those from those myths, then certainly we would be able to put our 360-degree approach to deal with sustainable development goals. And this 360-degree approach is very much required when people are actually they are surrounded by the myths that what is the sustainability? Is it a green movement? Is it something which is related to population only? So this thing is very much important to understand that for sustainable development goals, if we want to achieve them, we have to go for 360-degree approach. And for 360-degree approach, we have to burst these myths. And that's what that is where I want to conclude my talk on sustainable development goal. Thank you, ma'am.
Thank you. Thank you so much, ma'am. So now I'll be the last speaker, and then I will also give my presentation like very briefly. So someone else, if I'm exceeding the time, like please give me a tap. So today, like I'm going to discuss about the challenges and opportunities in communicating health. So I just want to give, start with the example from Mizoram, how, like what are the challenges and opportunities, and then how it can be, generalized also. So health communication, it strives to communicate science in ways that resonate with audiences and gives them action steps to improve their health and prevent disease. So, in Mizoram, we have like there are like many public health issues are here. For example, Mizoram is called as cancer capital of the country, and Mizoram is having the largest people like living with HIV/AIDS. And then we have this infant mortality rate in one of the districts of Mizoram that is even higher than the national average. And malaria, dengue, tuberculosis, and even substance drug abuse, it's also like another one important issue. And even Mizoram has the highest tobacco consuming population in the whole world. So that is there. And there are, when we talk about this health communication, there are a lot of research that has been like done on this health issues, particularly in Mizoram, and I think it's also applicable to other states also. So for example, I just want to focus on one issue, that is infant mortality rate. So infant mortality rate also, that is different in different parts of the world. And in Mizoram, particularly in Siaha district, they say that the pregnant mothers who are taking like 4 or more kuwa is that betel nut, the areca nut, intake per day during the pregnancy, that is associated with the infant death in their investigation. And when they study about this cataract surgical services in Mizoram, they found that the most of the patients, they lack the information which they wanted. So it was like so delayed when they go for the doctor also. And many of the patients, they are also kind of practicing self treatment, that is also there. And again, when the research on this breast cancer, they found that smoked food and the consumption of the smokeless tobacco, that is in a liquid form, they are taking that, they call it like tobacco water, that is this tuibur. So these are the issues. So like many of the health issues that can be prevented, but that was not like communicated properly. So that is one of the important challenge. And the next challenge, when we talk about the health communication, media also plays a major role. And when it comes to Mizoram, even though it has like more than 200 newspapers, but like after pandemic, like people are hardly buying newspapers outside Aizol. And even the television reach is high, but it's mostly entertainment. And mobile phone reach is like it's reaching like more than 90 percentage of the Mizoram population. And even when it comes to mass media exposure also, only in the Aizol district, that is the capital district, they have like more exposure. But when you see the other districts, they have very less exposure to that one. So when globally, the below poverty line people who are living on 99 cents a day, means they have also have limited access to information. So newspaper, television, and books, and which all cost money. So they often just don't know certain facts that the rest of the world taken. So that is one of the important challenge. So, and another one thing we are having, even though it's a small state, also here there is a heterogeneous population, different dialects and different ethnic groups, right? And then most of the media, traditional media, they are still in the developing stage, and there is like lot of, there is no not much trained media persons when it comes to health communication, and there is a huge disparity between rural and urban population in media consumption, and there is also a huge disconnect between lab and society. So in the laboratories they are doing a lot of research on this health issues, but it's not being like taken to the society, and it's not reaching the society. And again, another one thing, we need to contextualize the health communication. So it cannot, each and every state and each and every district has its own unique problems, so we have to like address, and it has to be like tailored and contextualized for that particular region. So that is one thing. And another one thing, when it comes to health communication, the most of the things that are also like getting lost in translation. Even when you see that when Dilip sir was presenting, like most of the project, it's all in Hindi names, but it's not understandable. Even I don't understand like what are the project titles, no. So that is there. So we need to to be like contextualized, and then it also has to be what you call translated properly. And then digital media, when we talk about like digital media is the only media which has reached everyone, but it's also with lot of misinformation and disinformation, right? So that is one thing. And another one thing, the only opportunities we have is the alternate media. So for example, in Mizoram they have their Klangao, that is the public address system in each and every locality, run by the young Mizo Association. So and even during COVID they found that the people, they receive valuable information from the local NGOs, that is the YMA, the Young Mizo Association. So it's better to see, for instead of focusing more on the traditional media, we have to like focus on this alternate media, what are the channels we are having. And then the social media is very important, right? So when you are communicating to the Gen Z and the other people, like it's better. And there is a lot of misinformation is also there, so it's better we accelerate the communication through that one. So that is one thing. And what one thing is that the should be the focus of the health communication is that preventive care should be the focus of health communication, right? So people are not already sick, so you can give them the proper information so that they won't be sick. For example, in Kenya, children who were given deworming pills in school for 2 years went to school longer and earned as young adults 20% more than children in comparable schools who received deworming for just 1 year. So you just see that even a simple thing like taking deworming pills, that is very important. So how even the health is also related to other sustainable development goals, like education, quality education, and then even their employment in future also, no, that is there. And again, when it comes to this one, so the piece of information is very important, and that small, that little nudge can do wonders. So many of the times the lack of information about the benefits, or the fact that poor people cannot afford them, that is also one issue is there. So the real issue in front of us is that the path forward is not better like big thinking, but thinking small. So we should like start like thinking of like taking small steps by giving like relevant information, right? So the simple information. And then another one thing is also that people tend to be suspicious of outsiders who tell them that they should change their diet, right? Probably because they like what they eat. So there are in history also, we know that for example in 1966 to 1967, when the rice prices went up sharply, the chief minister of West Bengal like suggested that eating less rice and more vegetables would be good for people's health and easier on their budget also. But it received a backlash, and then there were like a lot of protest and everything. But again, in another in France, what happened that Antoine Parmenter, actually he was an early fan of the potato, and he know that when if he is going to say that you eat potato, people won't, they will resist, right? So anticipating the resistance, what he did is he offered the public a set of recipes he had invented using potatoes. Even they say that this shepherd's pie, they call it in British, they call it shepherd's pie, and then France they have this hashish fermenter. and even it is also called like freedom fries. So that guy only like invented. So that's what, like, instead of telling them, you should not eat this, we should, like, change the way how we like inform them also. That is there. And again, another one thing, we are like again and again going off communication, that one way communication, we are just giving information, but there is no such collaboration with the local, civil society. So all the stakeholders has to be like involved in that, and they have to be like engaged in that, then only you can do that one, right? And then when we talk about like health communication also, instead of like talking about big things, let us like focus on the simple thing, right? And another one thing, we should not like remember, we should not forget that information alone will not do the trick, right? So you just say that people to just, you have to take deworming medicine, or you have to drink, chlorinated water, and you have to sleep within the, mosquito net, yes, right? But again, you should also like find ways of giving them, in a, what you call, you should like try to find ways, and then we have to give them through the welfare schemes. So that also plays a matter. And it was established by, that in his book, Poor Economics by Abhijit Banerjee and Esther Duflo. They were talking about like this randomized control trial, and they are talking about like how simpler, the disease care could be eradicated through simple, inexpensive programs, right? So that is there. So that's all I want to say. Yeah. So now we can move on to the question answer session. So four speakers presented their views. So if there are like any questions or comments or suggestions, now it's open. I think everyone is still feeling drowsy. We can see. Yeah. No questions or no comments?
I think there are no questions, ma'am.
Okay, then I will like ask the speakers to sum up, like if they want to have a last, comment for 30 seconds. Yeah, we can like start one by one. Ruhi ma'am.
Hello, everyone. So, it is, I'm honored that we are here and discussing about discussing about demystifying communication strategies toward sustainable development goal. So as an end note, I would like to say that for achieving sustainable development goal, it is very important that we all should come together. We should help students for achieving quality education, and we should provide students with skills and knowledge they need to become productive member of the society. It is very essential for all of us to work together for ending poverty, promoting gender equality, improving health outcomes, and reducing inequality and fostering economic growth. When we all will come together, then only we can achieve sustainable development goals by 2030 as targeted by United Nations. So we have to ensure that all students, they have access to free, equitable, and quality education, primary as well as secondary education, school education, college education. We have to focus on everything so that they can become responsible citizen of the nation. So with this, I would like to end.
Okay, thank you, ma'am. So Dilip sir, just the concluding remark. Or Archana ma'am, do you have any concluding remark? Yeah.
Yes, I think that for concluding remarks, I just want to say that these myths around sustainable development is very much needed to be busted, because sustainable development goals, people are not thinking, not actually understanding many point of it, and if they will understand it, they will automatically started contributing towards it, and that contribution means a lot, because as Rohi ma'am has also said that 360-degree approach approach, and all of us will need to come together and then participate in this particular goal to fulfilling these goals till to 2030 is very much essential. So that's why I just want to conclude that kindly understand what are the main features of sustainable development goals, and do not fall into the trap of the myths around it.
Yeah, thank you, ma'am. Dilip sir, do you have any concluding remark?
Yeah, we can say only one thing: if we want to remove the poverty, not only from the India, from the entire world, the developed countries should play a major role to towards the underdeveloping country. Then and there, we will be even fulfill the dream of Sarve Bhavantu Sukhna, Sarve Santu Niramya, Sarve Bhadrani Pasantu Ma Kasitu Bhavu. That is the thing. On the basis of that, we can, yes, remove the entire poverty, and poverty is the kind of disease which will be not even benefited to everyone, anyone. So we should think about constructively and try to help each and every aspect to each and everyone. That's it. Thank you.
Yeah, thank you. Thank you, everyone. So let me also conclude this session with two, three, like I'll just sum up the whole session. So we had an interesting discussion on this sustainable development goals. So Ruhi ma'am, she was talking about like how it's not only the access to education, but it's also about quality education. So she's also talking about the quality teaching and also the need for the inclusive teaching environment, which is, we normally just ignore that part, like inclusive learning environment, right? And then also how this access to quality education can also like reduce inequality. And Sir Dilip was talking about like how poverty is, kind of man-made disaster, and it can be like prevented, right? So if all the government initiatives or focused on that one, and we can eradicate poverty like before 2030 also. And Dr. Archana, she was also talking about like various myths and how regarding the sustainable development goals. And the one thing was that how we should be like we should have our conviction and commitment to the sustainable development goal. And we should also like bust the myth that technology cannot be avoided, but it can be like used to optimum. So in that way, so and when we talk about all these sustainable development goals, quality education, poverty alleviation, and then health communication, good health, everything are like interrelated. If someone else is like healthy only, then if and only they have food, then they'll be like healthy, and then they will also have a good education, and based on that education, their life, quality of life will also be like improved. So each and every sustainable development goals is also like interrelated and interdependent, and we should all like work, collaboratively. And then all these NGOs and civil societies which are working on this sustainable goals also have to work together. Yeah, with that, in like I will end this session. Yeah, thank you each and everyone for your time and your sharing your expertise and knowledge. Yeah, thank you. Thank you, Ramrita, for hosting us and having us. Yeah, thank you.
Thank you, ma'am. Thank you, speakers, for the enlightening session. We are honored to have your presence at ISMER 2023.